is Suzanne Feaster. Thank you. I'm President and CEO of Vitalist Health Foundation, and I'm privileged to be working on this project because it really has been very, very interesting and very insightful. Our board, and my shout out to my chairman, Nick Vasquez, who's on the Zoom, asked that we look at how the money through the American Rescue Plan Act was being expended, get community input, and that might help shape what Vitalist did going forward. So that really was the genesis of these virtual town halls. So really we have two questions we want to cover today. Pat Norris is going to lead you through that conversation, and our former president of Town Hall. We also have our new president of Town Hall, Evelyn Kasuga, is on as well, and our CEO, Tara Jackson. So you've got a crack team here. So let me turn it over to Pat.
Well, Suzanne, thank you very much. And ladies and gentlemen, thank you for being here. I can see some friendly faces around the room. It's nice to see you, Cal, and Christine, and Tony. Thanks for showing up on the second day of this. I see that you're a repetitive offender, so to speak. So anyway, it's great to have you here. We're going to use your time wisely. And as Suzanne mentioned, we have prepared two questions to discuss the day. And I will read each question in advance of discussion to make sure we're all on the same page. We encourage you to listen intently to what everyone is saying, because we're going to ask you to discuss, and I hope set some priorities on what you think are the most important areas these monies, and there's a lot of these monies, there are billions of dollars the state will receive and is receiving, can best be utilized to address health and wellness disparities in our communities. So stop and think before you speak. And although we can be more powerful if we all speak and we agree and reach a consensus, as Suzanne mentioned, we're here to hear from you. And so if you have ideas that others have not voiced, please raise your hand and voice those ideas, because all the ideas are things that we are going to then memorialize so that Suzanne has all of this in her material so that she can use to address with policymakers. If you agree with something that a person has said, feel free to put your real hand up with your thumb up, your real thumb up, or, and this is important for also getting in the queue to speak, if you go to the bottom of your screen, depending on the type of equipment that you are using, you will see a little face that says, and under that says reactions. If you click on that reaction button, you will then see an icon or some words to the effect that say raise hand. If you click on raise hand, then I will see your virtual hand. Thanks, Alex and Suzanne, to mirror that or model that in your tile. And that way I will know you wish to speak. Some of you I know may not have that feature. Therefore, if you can engage your video, then if you'd like to speak, I'll be kind of going back and around the room and looking at it. I'll see your hand, I hope, up, and that way I'll know to call on you. The other option that you have is if you'd like to speak, you could put just a quick note in the chat room, please call on me, or I'd like to say something. And that way I'll be monitoring that. I'd also encourage you to use the chat room, especially if you have some points that you want to say, hey, I agree with what Claire had to say, or Deborah hit the nail on the head. I agree with her on this. So everyone will have a chance to be heard. I'm going to call on you pretty much in order in which I see your hand, either your virtual one or your real one. And I'm going to call on you by first name, because all of us in Town Hall are by our first names, regardless of what our titles are in our day jobs. I believe that we may have someone on the phone, and if you are on the phone and you'd like to have a name and not just a number, please let us know in the chat room who you are, if you can, or at least tell me now who you are, and I'll make a note so that way I can call on you by name and not by number. So just if you would like to do that, then in order to use your, yes, sir. Your
Sorry,
name?
it's Josh, KNAU, Arizona Public Radio.
Right. And did I hear your name, sir, is John?
Josh.
Josh, thanks. Josh, thanks for being here. We're glad you're here. I will call on you rather than say your last digits of your phone number. Thanks, Josh. So
Thank
that
you.
everyone will have a chance to be heard, I would encourage you to follow what I call the 60-second rule. Some of you have heard me talk about this. And as a recovering lawyer, retired judge, I know that lawyers and judges can go beyond 60 seconds. That's why I have this rule, which is if after about 60 seconds you're still speaking, chances are likely you are repeating yourself. So just self-monitor and recognize that when you hit around 60 seconds, you're likely repeating yourselves. I think that covers all the preliminaries. Are there any questions that you might have on the process that we're going to follow today? I'm looking around the room. I don't see any hands. So let's go ahead and then begin. As Suzanne mentioned, and as you may have read from the fact sheet, Arizona is in the process of receiving significant one-time funding from the American Rescue Plan Act, and then before it, the CARES Act. And so the first question asks you, where are the most important areas to invest these funds to address disparities in health and well-being? Now, let me make it clear. These are talking about the broad categories where we should be using these funds. If you go to the fact sheet and you look at the second page, you will see that the billions of dollars that Arizona is going to receive have generally been allocated to 6 different broad categories. They include, for example, direct COVID response and public health measures. Direct business aid is another category. Another category is education programs and services. A fourth category is human services, programs and services. A fifth category is housing assistance. And then we have, as our 6th category, health-related programs and services. Our second question will ask you to talk about what are the most important needs in each category. But this question focuses you on which categories should be front-end loaded, is the most important one that we should be using to invest these funds to address disparities in health and well-being. So this is on a big, kind of on a 30,000 foot level, dealing with the categories. So again, based on this one-time federal funding, where are the most important areas to invest these funds to address disparities in health and well-being? And final point, this question asks you to set priorities. If everything is important, if everything is urgent, then we don't have priorities. I mean, we can do more than one thing at a time. There's no question about that. But recognizing that we do have limited, finite human resources, we can't do everything at once is the reality. So where would you prioritize these categories? So, ladies and gentlemen, I'm going to turn this over to you for your conversation now. And by the way, the question, Tara has, or Alex has put the question in the chat room as well, in case you need a refresher.
Okay, I know a lot of you and you are not shy people.
Well, I was getting ready to say the same thing. And actually, I was going to pick on Christine because I know her and she must have channeled my mind because her hand is up. So Christine, why don't you lead us off on this discussion?
Sure, glad to. Just having spent so much time in the last year in the housing realm, I think that multiple issues have come up because of COVID: access to affordable housing, eviction prevention or defense. And there's a lot there that's impacting seniors, young families. and children, especially when their housing is disrupted. So I'd like to throw out there that housing assistance and human services programs should be or could take a priority for the health and well-being.
Christine, when you talk about accompanying housing assistance with human services, are you talking about those type of human services that are devoted to keeping people or to helping people obtain housing, or are they ancillary services such as providing adequate food, food stamps, employment, other aspects that are also important?
Both. I think that I tend to think that when people don't have money for rent, they take from their food, or when they don't have money for rent, they take from their healthcare or their medicine. So I think that making sure that there's supplementary resources so that people aren't borrowing from one thing to stay housed is important.
Christine, thanks. Tony? We need to have you unmute, okay? Still can't hear you. There you go.
There, okay. Clicking the buttons too quickly. What I believe that from my perspective and what I've witnessed is the mental and behavioral health training for healthcare professionals and public safety officers. The mental health and behavioral health aspect is just so important when you talk about health and wellness disparities, because it is something that really impacts people and families in a large scale. And it's really is something that shortens life, because you get people with mental or behavioral health issues. They oftentimes have chronic diseases. They don't take their medicines. They just get compounds and worse. And we see it in a number of areas. As I mentioned the other day, homeless, PTSD, it's all over. It's all over the whole spectrum. And then second is funding to schools to connect to the internet. I think that brings back again broadband and especially broadband expansion, the last miles into the rural areas. It really paid or brought its ugly head forward when we had so many people trying to work from home. Kids in the rural areas were not able to connect. Those are my comments, my priorities.
Tony, thank you very much. You had a lot of head nods around the room regarding the critical importance of mental health, behavioral health, the needs, because that's just so pervasive. And actually that ties into causing problems with lack of housing as well. And also as to the internet, we certainly have seen that really important. Then Cheryl has placed a comment in the chat room, says she agrees with Christine's comments. Once one ball drops, another one drops, and it just becomes a crescendo. Stable, affordable, safe housing is an important foundation to individuals and families. Cheryl, thanks for saying that in the chat room. Other comments, or perhaps you agree that that housing, job one, behavioral health, job two, are almost similar to job one. Other comments, Stephanie, thank you. We'll need you to unmute.
Of course, the second person you've had to say that to now. I
You won't
want to
be the
reiterate
last either, okay.
probably not, about the housing and affordable housing. But I also want to bring up home ownership as part of that affordable housing, because I think the affordable housing conversation gets hijacked a lot by just rental. And we're not talking about building wealth for people so that if a ball does drop, they have that safety net that was built into their home ownership. So I agree that housing, human services, but also let's not forget the home ownership aspect of affordable housing.
Stephanie, thank you very much. That's a good point to make sure we haven't slipped it up. Other comments, ladies and gentlemen? this program was designed to bring together people from all over the state. So your perspectives may vary a little bit. So please feel free to raise them, because it's not a one-size-fit-all priority in the entire state. So just keep that in mind. We are a diverse group today. Erin, thank you.
Hello, I just thought I would add in, I definitely agree that housing is a huge component, a huge social determinant for positive health outcomes. And in thinking about I don't know if one-time funds is the place to do this, but also I see a lot, and I think the pandemic really made this obvious, that the administrative burden for some of these programs can be very high, and it can be a lot of barriers for people to navigate the system, a lot of barriers for providers to get those funds out to people in a timely manner. So thinking about the administrative efficiency of programs is just something I think is important.
Erin, thank you. You're absolutely right. Sometimes beside our best efforts, we can get bogged down because we're not prepared to implement the administrative aspects of a program. A couple other folks have weighed in the chat room, agreeing that education, housing, medical and mental health services, and care are categories that are extraordinarily important. Charity, thank you.
Hi, good afternoon. Something that stood out to me on the fact sheet and the category sheet was the pandemic impact on social conditions. The category is health-related programs and services, specifically on pregnant women, disadvantaged pregnant women, women of color, low income, tribal communities, as well as homeless women and teens. And just to dovetail off the housing, I contacted my certified nurse midwife who delivered 3 of my babies and asked her what needs she's seeing in our community. And she said she had a woman who was homeless who CPS threatened to almost take away her child if she wasn't able to find housing for herself. And so she was able to find temporary housing, but that was just a need that she saw, as well as teens. I know that on the fact sheet also mentioned that a quarter of people that were surveyed in March 2021 were delaying their medical care appointments because of lack of finances. And I'm sure that includes women missing some of their prenatal appointments. And when those are missed, they can have an increased risk to their own health and to the baby's health. People in these groups are already at risk and disadvantaged, but the pandemic just added another level of difficulty for them. And so funding could be made to these communities through different organizations to help with that. So I have more details, but just for the sake of time, that's kind of the summary. So
Good points, Charity. You're absolutely right about the importance of getting health services to our communities that are of color that have already been disadvantaged, and to try and then make sure that we have appropriate early neonatal services and not get pushed by the side. Nick, please.
I guess I'd like to take a chance to reiterate what she said in some ways, but also to really highlight. So recently, Commonwealth Fund did an analysis of high performance health systems in the US, did not do very well. We spend a lot of money on healthcare, but we don't get a lot out of it. And one of the elements of the high performing systems was offering social support for moms and kids. I think the federal money would be well spent if we focus on social support for mom and kids, given pandemic's impact on mothers in the workplace, given the mental health impact that the pandemic has had on children, and given the educational impact that hybrid learning has had on Black and brown kids or low income kids around the state. That's something that I think would apply universally to all the different aspects of Arizona, whether it be rural Arizona, tribal Arizona, or urban and suburban Arizona. So for what it's worth, I think the number one priority has got to be some of the most vulnerable among us. And I would think that after the pandemic, that's mothers and kids.
Thank you very much. And you know, it is one-time funding, but the funding has to be expended within, for many of these type of programs, within the next year or two. But it can start, it can pave the way. And for example, to build on Charity and Nick's comment, the 3.5 million for education program services, significant portion could go to after-school programs for disadvantaged or homeless children to help them make up. And then, of course, we have in health-related programs, monies for access and the like. So we'll be talking about how to categorize what should be prioritized in the categories in our second question, but so keep those points in mind. Sonora?
Hi, this is Sonora Crittenden, Manager of Community Benefit and Health Equity at St. Joseph's Hospital. Also, you might have seen that description under Terry's name earlier. Sorry, Terry, I used the wrong link to join, but I wanted to just weigh in and first say that I totally agree with what Dr. Vasquez just said. And this is kind of echoing others' opinions, but I think the health-related programs and services, as well as the human services and programs, are extremely important. I know that housing is separate, but you know, I see it as kind of one of those social determinants. So I think those three are very important to focus on. And I just wanted to, you know, forethought that I know these are one-time funds, so I think that we should really be looking within those categories at models that can be sustainable and that can continue to kind of live on once this funding is gone.
Sonora, that's a great comment. And indeed, if you read the regulations and the proposed Department of Treasury regulations, the regulations make a point, if this could be used, it's one-time funding, but it sets the stage for additional actions and activities. Aaron, your comment about having a infrastructure that can administer and implement these programs and fundings is underscored in the chat room by Patricia, who makes a very similar point. Ladies and gentlemen, any other discussion on this question? Otherwise, we'll move to the second question. And Beth, thanks for your comment about affordable housing, also food insecurity and the importance of food availability. Anything else, ladies and gentlemen? Well, thank you. Let's now move then to the second question. And let me just explain that we are not only recording this, but we are listening very intently to the discussion and taking it down the old-fashioned way, which is either typing it or listening to it and writing it down. And a wonderful town hall volunteer, Mary Greer, and others are doing that. And so we're making sure that we don't lose your comments, that we have them down. Pamela, I was getting ready to move on to the second question, but did you have a last comment regarding the first question?
Yes, I did. Thank you. So I'm Pamela Neal, and I'm with my own business. It's called Safe Schools, but we do teen court. So we train young people in the court and the law. So I just wanted to point out that I think education is a big factor to me, having been a former probation officer, because a lot of these things that we're discussing affect young people, and it has to do with crime as well. So if they don't have a place to live, then that causes stress on the young people. We're having a lot of young people that are committing suicide and, doing all kinds of things. So again, I think education of our young people to deter crime is important, as well as, making sure that we focus on housing and healthcare and all of that. So I do think, that what everyone's saying is good stuff, but I'm more focused on ways that we can educate and help our young people.
Pamela, thank you very much. And again, I think some of the priorities in the categories can be used to address some of your concerns. So let's move on to question 2. And we have put into the chat room question 2 as well. That way you can follow along. Considering the specific areas, or what I have been calling categories, identified in the American Rescue Plan Act, Again, education, human services, housing and health, that includes behavioral health, direct COVID response, public health measures, housing, I think I meant human services programs, direct business aid. Considering these categories, what should the priorities be for utilizing this one-time funding for these areas? So think about this. What should be the priorities for using these one-time funding, billions and millions, in these particular categories and areas? Christine?
I figured I'd just throw myself in there again.
Thank you.
Before you
There's
called on
nothing
me.
like you leading the way. Okay, good for you.
With respect to the categories, there's one area that a lot of funding in other jurisdictions or states have done is to focus on legal representation for low-income folks. And I raise this not just because this is what we focus on and what we do, but because the pandemic itself has created a number of new legal issues for folks, whether it's unemployment, whether it's different health benefits issues, housing, especially with a CDC order one day and maybe not the next, related to eviction. And so I think having someone able to address the multitude of legal issues that are coming up, and I think that needs to be done in two ways. One is public legal education, so people understand their rights and they know they have a place to go to find what is happening with them, and then representation for protecting those rights or making sure that they're okay. This is sometimes a benefits issue where their maybe benefits were cut off and that's a legal problem, or their employment, wage theft, that's a legal problem. All of those types of things can also impact someone's housing stability when we're talking about trading one expense for another. I think legal services can really go a long way in providing that kind of stability for people without the bad consequences that come with an eviction or with a unaddressed legal issue. So I'll put that out there as under the category of housing assistance or human services programs. It kind of falls under both, but I think that legal services and public legal education can be a really important tool to helping solve many problems.
Christine, thank you very much. Deborah?
Thank you. Under the category of health and/or human services, I hope that there'll be more priority for older adults. Prior to the pandemic starting, social isolation among seniors was emerging as a public health crisis. The research has showed that the impact of prolonged isolation for seniors is the health impact is worse than obesity and equivalent to smoking 15 cigarettes a day. Think about what the last year and a half has meant for seniors who already were isolated and homebound. There needs to be more programming, more funds for older adults that touches somewhat on behavioral health, but also on the socialization side. The Aging Network, of which my organization is a part, has good resources that have been coming in from the feds for the meals programs, particularly Meals on Wheels types of initiatives. But that socialization piece and the related mental health pieces to that are critical for our older adults in the community. Thank you.
Deborah, thank you very much, because you're right. Oftentimes we don't focus on that part of the population. Dr. Nicholas has raised an excellent question, or actually a refinement of what we're trying to address in this question in the chat room. So let me read it to you and ask you to reflect for a few moments about your response to his excellent refinement of what we're trying to address in this question. He asked, what one thing in each of these areas, if purchased or created, would fundamentally change the challenge of serving the needs of people in these areas. I'm going to have to underwrite you, Dr. Nichols, and ask you to please start working with Town Hall on crafting all of our questions, because that's a great way to phrase it. So thank you. Sonora?
Hi again. I think this kind of goes along with the initial question as well as the one that was just raised. So this is something I think that could be kind of under the health-related programs and services, but also the human services programs. And I just wanted to raise the thought about community health workers and really being able to build that model and have a consistent, standardized model for that work in our communities. I think it's something that we all in this space know is crucial and can have a great impact, but it's work that is difficult to standardize and I think even more difficult to sustain because it's typically just through grants or different models like that that can be lost and then the position's gone. So I think training that workforce and developing that is something that could continue to improve those areas over time once we have a dedicated trained workforce.
Charity definitely agrees with your comments. I see some thumbs up here and I saw some nods around the room. Then let me encourage you all to take a look at the chat room. As Pamela has already mentioned, as she thinks about this in answer to Dr. Nicholas's refinement, it's after school programs. And indeed, that is a line item within or on the designated use or appropriate use under the education programs and services. And then Zeta has made a very good point about how we have approached these issues from an infrastructure basis from the entire state. Her comment's an excellent one. So I'd encourage you to take a look at it. Then Charity, please.
Yes, agreeing with Sonora, looking at these categories, the one I would, of course, emphasize again, maternal health and child services from the health-related programs and services category. I spoke with a representative from Common Sense Childbirth, which is an organization helping women of color have equity, justice, and fair treatment in childbirth in the whole nation. And I asked her if she had any response or suggestions for this funding in our area, or even generally. And what she said that came up besides some suggestions I had mentioned, one thing she mentioned was, like Sonora said, training and deployment of community health workers, especially in the field of maternal and child health, especially people of color within the same community. So there was a study done that Black babies have better statistics for health and viability, being healthy, if they have a same color provider caring for them. And so that's something that she had talked about that really gets boots on the ground to help people of the same type of race, from the same community, recruiting them to become community health workers to help those areas.
Charity, thank you. I saw some virtual thumbs up on that. Again, the chat room, you're making great comments, ladies and gentlemen, in the chat room. So I don't want to overlook those of you who prefer that way to communicate. Julie points out the opioid substance abuse crisis co-occurring with mental and behavioral health and trauma. Care for the whole family, provide holistic integrated care, can provide both intervention and prevention in an intergenerational basis. So thank you very much. Again, to Dr. Nicholas's refinement, what monies could be used most effectively to either create or fund a program, an event, an item that would fundamentally change the people who are in this area? Cal, thanks.
Yeah, one of the areas I think that when it comes to behavioral and mental health, obviously that's been an issue long before COVID, especially in our state and in the rural areas. Maybe investing in infrastructure and using the technology we're on today so that we can bring those providers to those in the rural communities, because we don't have access to psychiatrists or any of those types of things. So we're using mid-level mental health or behavioral health folks when we could have access to a professional via the computer and have maybe a caretaker there. But if we built that infrastructure now with these one-time funds, that's something that could be sustainable into the future. And that's really what's important.
Cal thinks, and Cal says that having a presence in our northern part of the state along the Colorado River and the like. So, Cal, anything else on that? Okay. There are a number of comments in the chat room regarding either the absence of data, or it's not, the fact it's not available either on a local basis or on a statewide basis, and how a lot of times when we have data, it's aggregated, so you don't get really a clear understanding of what are the conditions on the ground in our more local areas. And so a number of you have commented about the infrastructure that I'll call it the information infrastructure, and what needs to be done to improve that. Other comments? You've talked of importance about housing. And again, if you look at the monies here that relate to housing, and there can be a different, housing is very broad. For example, earlier in our meeting today, one of you mentioned the importance of actually providing assistance for people to own their own homes or buy homes. That way they will have a source of maybe family wealth in case they run into trouble down the road. So it's not just rental assistance. Perhaps it also needs to be used to provide assistance for people to buy in their homes, or to perhaps help them pay their mortgages for those who already own their own homes. Thanks, Stephanie. Thumbs up on that. Well, as I give you time to reflect, let me make a couple of announcements. After this session is over, we're going to send you a short survey. It will list the 2 questions because you may have additional thoughts you'd like to raise in response to these questions. So please fill out the survey, and we'll be asking your comments about this process that we followed today. So please be candid, be nice, but be candid, and let us hear your thoughts. And we'd really appreciate you taking a moment or 2 to complete the survey. Any additional comments in response to this question about prioritization within these individual categories?
This is Josh over the
Thank
phone. So I'm a former victim services sector worker here in Northern Arizona. So I agree with most of what everyone has already laid out. I would just want to add that, I hope this, because it's one-time funding, I hope we can prioritize entities which have been providing these sort of healthcare, housing, mental health services for decades. I mean, Northland Family Health Center, Native Americans for Community Action, these places have been doing things like this for decades and have the framework, have partnerships in place to expand their capacities. And this needs to be communicated as well. So, a little shameless plug, public radio is great for that across the state. All the stakeholders tend to be listeners. So I think, prioritizing those places are important.
Josh, thank you. Any other comments, ladies and gentlemen? Otherwise, I will turn this over to Suzanne to basically conclude our meeting today and let you know where we're going. Tara?
I just have a quick comment. I wanted to wait to hear the response of others to the question that Nick raised. And I thought I would weigh in as someone who has listened to not only all of the programs and conversations we've had to date on this particular topic that Pat has done a wonderful job of facilitating, but also the Arizona Town Hall has been conducting a number of other programs around the state, whether it's on the topic of creating vibrant communities or working in partnership with NACOG and MAG and other organizations to address these issues. And so taking all of that information that's come in from all of this active listening, I thought I would, for Nick, give you my thoughts on summarizing what I've heard from all of those programs, because I agree with Pat that you've asked a very good question. How do we prioritize, especially how do we prioritize when this is one-time funding? Using that filter, and based on what I've heard, I know Pat's been at a lot of these programs with me, so I'll be curious if she or others agree. Investing in broadband infrastructure, especially in those rural areas or other communities who need it, would help address so many of the other issues that have been raised today. So that would be a number one investment of one-time funding that we've heard over and over again, especially in rural Arizona. So to Cal's point, another issue that came up very specifically yesterday in a program we had that I thought was interesting, and I've heard reflections about, is this vaccination campaigns. The point being, if we had more people being vaccinated, we wouldn't have to continue to address all of the issues that keep coming up, and that might be a one-time, a good use of one-time funding that addresses these issues. The third one that comes up repeatedly over and over again is housing, whether it is subsidy or mortgage, rent or mortgage assistance on a temporary basis, or workforce housing. Again, especially in some of the rural areas, finding that workforce housing that's for our teachers, firefighters, and so forth. So I just thought I'd summarize to try to answer your question as best I could.
Tara, thank you. And I will say, having attended each one of our Vitalist sponsored sessions on these two questions, I think Tara has summarized exactly what I heard as well. Housing, long-term, short-term, immediate assistance. Second, infrastructure for the internet of critical importance that also provides not just education support, but medical care. And then third, there's been, especially as we've seen the Delta variant and the increasing transmission rates, the importance of getting people vaccinated. And there's a great comment in the chat room from Jennifer about getting kids that, or at least can obtain the vaccine, vaccinated, and how we have a problem in making it available to kids and their families. So please read that comment. Anything else, ladies and gentlemen? Otherwise, I will turn this over to Suzanne for a wrap up and also a thank you for being with us today.
Yes, this has been very, very interesting. You guys have really brought a number of even different perspectives from the previous ones, and I've been able to participate in all of them. So I really appreciate that. And I hope you take advantage of the survey that I know has been sent, because I just saw it in my inbox. We are very efficient to give us any more feedback that you have. And again, you can go to vitalisthealth.org to see the summaries of the other. We've got at least 3 of the summaries up from the previous town hall meetings, and look at our report, which summarizes some of the activities that are going on around the state, and talking about what next steps might be in making sure that our elected officials and our government agencies look at disaggregated data, look at how we can address health equities, and really look at inequities in healthy communities, which will include not only health and healthcare, but well-being aspects such as access to healthy foods, adequate transportation, addressing mental health and social needs. So looking at how the intersection of all of those elements that really you need to build a healthy community. The other thing is, I will put in the plug, Arizona Town Hall will be doing a multi-day event in November talking about the creating healthy communities. So I think now that we have your email, we'll probably send it out to you to let you know if you want a further conversation about the intersections of these different elements in order to make our communities as healthy and resilient as possible. So thank you again for participating. We very, very much appreciate your time. And I look forward to reaching out and working with you guys in other activities. So thank you so very much.